In this video, we are going to talk about blocked bladders in cats. We're going to talk about what it is, how to spot it, and what you can do to help your cat to prevent them getting a blocked bladder. A blocked bladder occurs when cats are unable to pass urine due to a blockage of their urethra. The urethra is the tube that runs from the bladder to the outside. Blocking is much more common in male cats than in female cats due to their anatomy. When cats cannot urinate, urine is still being produced, and this urine will first fill up the bladder and then it will back up into the kidneys. This increased pressure can damage the kidneys. So if left untreated, a blocked bladder can cause acute kidney failure and even death in cats, which is why it is so important to know about it and to be able to spot it in your cat. A blocked bladder can occur due to a physical obstruction of the urethra, such as a stone or crystals or sometimes even a blood clot. It can also occur due to a spasm in the urethra, and this occurs because of pain in the bladder or pain in the urethra. Blocked bladders often occur in cats that are already experiencing painful cystitis, so preventing cystitis may help to prevent some cats from going on to being blocked. If you would like to know more about cystitis, please watch the video that I have made about cystitis. You can find that on my website, allcats.co.uk. Cystitis is not the only condition that can lead to blocking. Some cats will form stones in their bladders that can then block the urethra. And for other cats, we do not know why they suddenly become blocked. They may not have shown any signs of having trouble weeing, but may suddenly become blocked. There are several risk factors in cats that can make it more likely that those cats will develop a blocked bladder. We already discussed that male cats are most at risk due to their anatomy. Indoor-only cats may also be more at risk, as are cats from multi-cat households if there is stress between the cats. Cats who are overweight are also more at risk, as are cats who eat only dry food, because these cats tend to get less water in their diets and they also have a tendency to be more overweight. Cats who suffer from cystitis are also more at risk of developing a blocked bladder. And any cat who has had a urinary catheter placed is also more at risk, as this procedure may traumatize the urethra, which may make it more likely that the very narrow and delicate urethra may be damaged. Initially, you will see that your cat is having trouble passing urine. They may try to pass urine in the tray or on the floor multiple times. You may see your cat pass just a small amount of urine, sometimes with blood, or you may see them squat and try to urinate and not be able to pass anything at all. At this stage, it is impossible for you to tell if your cat has cystitis or a blocked bladder, as the two look identical in the early stages at home. As the urine fills up the bladder, your cat will become more and more unwell and be quite painful in their abdomen. Cats become lethargic, they may hide away, and they usually do not want to eat. If untreated, your cat will become progressively more unwell and more lethargic. Prevention is key when it comes to blocked bladders. Prevention begins at home by evaluating your cat's risk factors and making changes to reduce your cat's risk of developing a blocked bladder. These include changes to prevent cystitis and to manage your cat's weight. You can make environmental changes to help with stress, including providing hiding places for your cat and feeding individual cats separately if there is tension between them. Spending time with your cat and playing with them will also help to prevent stress and boredom, especially if your cat does not go outside. And plug-in pheromones may also help with stress. Providing large litter trays with a clay-based litter that has a fine texture and that clumps will also encourage cats to urinate more frequently. All litter trays should be kept in quiet parts of your house, and you should provide one litter tray per cat plus one extra. Water intake is also a really important aspect in preventing blocking and preventing urinary tract disease in cats. Encouraging your cat to drink more by providing water fountains or providing flavoured water from poaching a piece of fish or chicken will help your cat to drink more. And water bowls should be placed separately from food bowls and from litter trays. Water should be offered in glass or ceramic dishes, not in metal dishes. And eating wet food will also help your cat to get more water to help dilute their urine, which may help to prevent cystitis. Cats who eat more wet food and less dry food also have a lesser tendency to be overweight, as dry food is far more calorific than wet food. If you suspect your cat is blocked, you should call your vet immediately to let them know. If your vet agrees with your assessment, they will ask you to bring your cat in for an emergency appointment. At home, it can be impossible to tell the difference between cystitis and a blocked bladder based on your cat's symptoms. So if you're not sure if your cat is passing urine, you need to assume that they are blocked and take them to your vet immediately. As vets, we see many cats who come in with possible blocked bladders that actually have cystitis, and you can easily tell this from palpating their bladder. With cystitis, cats have very small bladders. It is still really important to see all cats with a potential blocked bladder in case they are truly blocked. A blocked bladder is a veterinary emergency. If your cat is blocked, they will need an anaesthetic to unblock the urethra. Depending on the case, the bladder may be emptied using a needle beforehand. X-rays and ultrasound may also be performed to help find out why the bladder is blocked, and a blood test may be performed to see if your cat's kidneys have been affected. Occasionally, a urinary catheter may be placed to help your cat to pass urine afterwards, but this is often not required. Your cat may also need to stay in the hospital for several days to treat them for pain and to make sure that they are passing urine. Blocked bladders in cats can be one of the most difficult conditions to manage because many cats will block repeatedly over a period of a few days. Because of this, it is one of the most expensive conditions to treat, and if your cat blocks, it is very likely that they will need very close monitoring over a period of several weeks. If treated early and there is no damage to the kidneys, the prognosis is good. If not caught in the early stages, cats can be left with some damage to their kidneys. This can result in chronic kidney disease, which may reduce your cat's lifespan. If you would like more information on chronic kidney disease, please watch the video that I have made about this on my website. Some cats can be more difficult to manage than others, and they may block repeatedly. For these cats, surgery can be performed to widen the urethra, and this comes with a good prognosis. Cost is often a limiting factor for owners, so unfortunately the reality is that prognosis is usually better for insured cats than for uninsured cats. A blocked bladder is a relatively common condition in young male cats. These cats are often overweight and indoor-only cats. This is a life-threatening condition for cats, so it is really important to monitor your cat's urination and call your vet if you see your cat straining to urinate. Cats who are treated early have a much better prognosis than cats who are treated later on. Blocking in cats is also one of the extremely good reasons to robustly insure your cat, or at least to have a plan on how to pay for medical care when your cat needs it. It is also a very important reason to reduce the risk factors for your cat as much as possible by maintaining a good body weight, feeding your cat wet food, and alleviating stress and boredom. I have more resources on my website, allcats.co.uk, and if you have topics that you would like to see a video on, please let me know and I will be happy to make one for you. See you in the next video.